Hello everyone, my name is Dr. Aajay Shah. I work for Oaklawn Hospital in Marshall, Michigan. I'm their full-time cardiologist. We are recording these short videos not just to educate my own patients, but to educate our community, not just in terms of their heart health, but to how to stay healthy as a whole person. So today we're going to talk about my philosophy on health and my philosophy on how I want to practice medicine for the next 30 years in my life. When I ask patients, are they healthy? They tell me, yes, they are healthy. But when I go in details, when I ask them, for them, health means waking up in the morning, taking shower, taking their medications, driving to their work, working 8 to 10 hours, coming home, eating, watching TV, and going to sleep. They define that as a health. But they don't know what underneath is getting them. Many disease processes are silent when they are working in a bad way on you. And those silent processes actually makes you more unhealthy than even having any symptoms. So I tell my patients that not having symptoms is not a sign of good health, because a lot of disease are many times like icebergs. Symptoms start very late and they progress very rapidly, and then you don't have much time left to reverse to live a healthy long lifespan. So to me, it's very important, not just we start with symptoms, but we start way before the symptoms happen. To give you an example, when it comes down to heart blockage, the disease starts at age 15 or 17. We looked at the Korean soldiers who were model of health. They were thin, they were exercising, obviously they were eating some unhealthy food. Many of them died in war. When we did the autopsies on their heart, they already had cholesterol plaque buildup in their arteries. So the plaque buildup in arteries starts at a very young age. And imagine if the disease, if the blockage, if the plaque starts at age 20, what it would lead to by age 50. I see so many younger and younger patients in my practice with heart blockage, heart attack, that I start to feel the prevention has to start at a very young age. Obviously, in medicine, prevention starts from infancy. As soon as a child is born, we start vaccinating them. So prevention should start at a very young age. But I tell my patients, prevention is never too late. Even an 80-year-old can not just prevent a lot of disease, but can reverse a lot of disease. So let me tell you where I stand, how we can prevent and reverse the heart disease. What you eat is what you become. That's something I learned from my personal example. Eating healthy, nutritious food, I call having a daily micronutrients is very important. Eating whole food, plant-based food is very critical. Having greens in your diet every day, eating cruciferous vegetables is very important. Eating fresh fruits is very important. Not only we have enough trials and enough studies to prove the benefits of eating healthy, highly nutritious food. We have enough proof now that eating too much meat, too much saturated fat is not good for you. If you want to look up the evidence behind what I'm saying, there's a book called China Study, which essentially goes into depth of eating plant-based food. To give you some information from that book, people in China have almost 1/10 of heart disease than people in America. Not only they have less diabetes, but they also have less cancer. So I tell my patients now that eating meat is fine, but that should be a condiment. That should be a small portion of your diet. Typically, 10% of calories from your daily requirements should come from meat. Same thing applies for dairy. Eating a lot of cheese and a lot of cheese-related foods is also not very healthy. Cheese carries a protein called casein, which is proven to be carcinogenic or cancer-producing protein. So eating a lot of milk-based products is also not good. You can replace them with almond milk or soy milk. Regular exercise is very critical. Actually, I tell my patients now that sitting is next smoking. Sitting is next smoking. Matter of fact, just sitting on a chair kills more patients than cigarettes, AIDS, or many other diseases, more than even car accidents. So chair was probably one of the worst inventions ever made. We sit all day. So now, for myself, I tell my patients that if you are a computer programmer, if you are a CPA, move every hour. Moving 5 to 10 minutes every hour is very critical. Fortunately, we have now simple step counter which measures your hourly activity. Try to purchase one of them. You can buy one for $25 or $30. The one I have is a Fitbit, which calculates my steps every hour, gives me a reminder to move every hour. Moving 5 to 10 minutes every hour is as good, if not better, than doing 1 hour of exercise. Obviously, daily exercise is very important. Exercise not only will help to lose weight, but will also make you better eater in terms of resisting the unhealthy food. Exercise gives you the confidence that you can resist the food. Exercise makes you sleep better, which lowers your cortisol level, which lowers your adrenaline type hormone, and it starts helping you in terms of your better metabolic profile. Exercise and sleep also lowers your insulin resistance, and your insulin starts working better, and that's also good for you. Other thing I highly recommend my patients is learning how to cope with stress and day-to-day stressful environment. Some kind of meditation, at least 15 to 20 minutes once or twice a day, is critical. I try to do it every day. Having a good family, good social support, having good spouse, good friends, good family members is also very important. Having a spiritual or religious belief and daily practice, weekly practice is very important. To give you an example, Seventh-day Adventist people, typical example is Loma Linda in California. Those people, Seventh-day Adventists, many of them are vegetarian, they don't smoke, they don't drink alcohol, and believe me, they live average 8 years longer and healthy life than average US male and female. So you can just live longer and healthier just by doing basic day-to-day healthy lifestyle. I think, to me, I tell my patients now, how much disease you're going to have is all in your hand. As a physician, we are available to take care of once a disease happens. But you yourself should be taking the charge. I make patients the leader in our team. I tell them that I can start helping you, guiding you, educating you, but eventually it comes down to you taking the lead. We have many patients now. Matter of fact, we have one patient on one of the other videos, Mr. Fluke, who not only has reversed the heart disease, reversed his diabetes, has lost weight, he feels more energetic, and he just feels like he's been empowered to live a long, healthy life. So in short, I tell you, taking care of yourself is one of the most important things to do. Your work, your family, your house, your car, your bank account, all these things can wait, but your health cannot wait. So take care of yourself. Thank you.